Welcome to Learn from the Greeks. I am Daphne Vitsikounaki. I'm the Economic and Commercial Affairs Attaché at the Greek Consulate in San Francisco. And it is my pleasure to introduce to you today's guest, George Eleftheriou. He is the co-founder and CEO of Sentio Solutions, a startup that has developed a wearable device to monitor mental health. Yorgos, thank you for joining us. You are in Greece now, so I say good evening to you over there. You are stuck there because of the pandemic, I presume. I'd like to thank you again very much for joining us today. And let me begin by asking you some basic data, some basic information. So where were you born? Where did you grow up? What were your dreams growing up? And what led you to your present professional activity?
First of all, thank you very much for having me, Daphne. As you said, I'm stuck in Greece, not the worst place to be in a world like this. But it's a pleasure to participate in this series of talks. Let me start by introducing myself. I grew up in Athens, originally coming from the island of Naxos, and moved to the US almost 10 years ago for grad school at Columbia University. After graduation from Columbia, I joined McKinsey and I was a management consultant with McKinsey and Cisco. After that, and during my time in consulting, as many other consultants, I was working extremely long hours. Many times averaging 100-hour weeks, and that was the point that I realized that I was not paying enough attention to my mental health. I was actually at the time experienced a panic attack, and that was the inspiration for starting this particular company. We started this company in 2015 with a very close friend of mine who was doing his PhD in biomedical engineering, and he was, as part of his PhD thesis, he was using sensors in order to quantify mental health and to detect the emotional state of the person. With our personal experiences at heart and his professional expertise, we moved forward in order to quantify mental conditions for the very first time.
Well, I'm sure this experience you described, working very long hours and experiencing panic attacks, is something that is widely spread, and many people have experienced this to a larger or a lesser extent. And I know you are passionate about helping people prevent or overcome mental health issues such as anxiety and depression. So how important is the societal value of what your company does to you as a motivation to overcome obstacles on your journey as an entrepreneur?
I think, Daphne, there wouldn't be any other way to do it if it was not for, I wouldn't say the value that we add to the society, but primarily the value that we add to individuals, to people that actually struggle with those conditions. It's been really inspiring for us to see that we can actually help them and support them in their difficulties that they're going through. From the very beginning, when we started this company, we were hearing people telling us that they would pay $10,000 right now to buy our device, and it was not about the monetary value of the $10,000 that we got excited, but by the fact that actually someone was had such a level of need to support their mental health that we could actually add value. Overall, mental disorders is one of the most important and pressing issues globally. We know that 1 out of 5 individuals in the US and globally struggle with a mental condition during their lifetime. So we're talking about billions of individuals around the globe, and the numbers are soaring, especially in times of coronavirus. We actually see 50% of individuals in the US again and globally to be experiencing significant mental distress. So I think that the overall need from a society perspective is very high, but especially in times like this, this issue has become a priority and should become a priority for the health system as well as for governments around the globe.
So true, and I believe and all our viewers and me personally, I must say that it's a great challenge to try and stay optimistic and try and remain in a calm state when the pandemic is all around us and we live in very uncertain times.
Right.
But Yorgo, could you please talk to us a little bit about how, in general, how technology has been leveraged to address mental health issues? Because I guess this is a domain that has, let's say, has been created or flourished within the few past years, right?
That is correct, Daphne. Mental health, in contrast to any other medical field, lacks objective data and objective measurement tools and any technological instruments to support the work that clinicians, psychotherapists, psychiatrists are doing in that area. If we take the example of other physical health conditions like diabetes or heart disease, individuals that struggle with those conditions monitor their glucose levels or their blood pressure on a daily basis, multiple times a day or even continuously nowadays. But when it comes to depression or anxiety or other mental disorders, we still rely on self-reported questionnaires and only on the feedback and interventions that we receive at the point of care when we meet with our psychotherapist once a week or once every other week. But we are experiencing those conditions 24/7. So we really need technology to bridge that gap and actually support individuals at their time of need beyond the weekly or bi-weekly appointments to psychotherapy sessions. As you said, over the past few years, there has been significant advancements. I would say primarily focusing on the telehealth aspect and the telemedicine aspect. That, of course, creates a different level of convenience, and it's very, very important. But I think that companies like ours or a few other companies in the market right now bring an additional element to that, which is very important. And this is the element of objective data and objective measurement tools that actually could help us treat and manage and diagnose mental conditions in a similar way that we do with physical health conditions.
So, do you have the bracelet around? Can you show it to us? Can you explain, right, what it is measuring?
Sure, absolutely. So through our device, we are measuring the response of the autonomic nervous system. That is a very accurate reflection of the emotional response of individuals. Probably you have noticed how you sweat when you are stressed, or how your heart is pounding faster when you're angry. all those are indicators from your nervous system that is telling you that an emotional stimuli just happened. This comes from the ancient human being that actually was wired to avoid danger, right? So when there was a danger in the environment, we really had to have our heart beating faster and our body ready to confront this enemy. So we base our technology on that monitoring of the physiological response, and there are very strong evidence that have been developed in universities like MIT over the past 25 years that showcase that there's a strong correlation between the emotional response and the physiological response of the autonomic nervous system. So we are measuring things like heart rate variability, electrodermal activity, skin temperature, and based on those measurements, we are able to detect if someone's experiencing an emotional event and what this emotional event is actually.
Right, and all those measurements, they are then sent to the doctor of the individual who's wearing it, or does the user get real-time information on what's happening?
So it's both. So the first level of support goes to the user, to the person that actually is wearing the device. So when we detect an abnormality, an abnormal activity, we actually send a notification to the user asking them to and trying to motivate them to take action, to do a breathing exercise, to do a cognitive restructuring exercise, or write a mood journal. And then we take this information to a licensed psychotherapist who is using the information as part of their weekly sessions with individuals in order to make those sessions as effective as possible. Please excuse me 1 second. Close the door. I hear some surrounding noise.
No problem, no problem. So, if I'm not mistaken, now during the COVID-19 pandemic, your company has also comprised a guide, mental health guide that is available also in Greece, right?
Correct, correct. We have had a few actions during the pandemic. We actually developed a new program that is tailored to the symptoms of COVID-19, to the mental health symptoms of COVID-19, to be precise. And because we realized the intense need that individuals would have for support during those difficult times. We have made this program available already in the US and will be available in Greece and Germany in the next few weeks. And the goal of this program is to support individuals during those times of COVID-19 and prevent them from struggling with a mental condition in the future, or in case they need additional support, to refer them to our field program that is targeting individuals with a more clinical need.
I see.
Yeah.
Which brings me to my question. I guess a company like yours that is focusing on mental health has experienced a lot of interest during these times. So the pandemic has created more business for your company at this point. Can you talk to us about what has changed in the way you lead the company because of these new requirements that came along with the pandemic?
I would say that definitely the pandemic has accelerated things in the digital health space, not only mental health, but overall digital health. Specifically for mental health, there has been change in regulations that will be very helpful in the near future. So the regulations from the FDA, from the CMS that were actually defining and developing policy around how solutions like ours would be able to be used. One of our advisors is the former president of the American Telemedicine Association, and he was telling me that he has been fighting for over a decade for the integration of telemedicine into the practices of clinicians, and the progress that has been done in the past couple of months has outweighed all the progress that has been done in the past 10 years. So definitely COVID-19 is a catalyst. For us, although we see significantly higher demand, we also see delays. Many decision makers from health plans or pharma companies or employers that are our primary clients have been slowing down because of the pandemic. However, definitely there is a big opportunity. And to be frank, going back to your previous question, there is a big opportunity to support thousands of people that right now are struggling with those conditions. Absolutely, I think that hopefully the learnings from COVID-19 will bring us into a better society into the future.
The digital transformation that you are referring to, also in the telemedicine field, we've witnessed it in Greece during the pandemic with the digital transformation of the state services, which is an amazing advancement that took place in an really surprising speed, right?
Yeah. Very short time frame, indeed.
So I'd like to move on to a more generic question now. So if someone would like to follow the same career path as you, what would they need to do, and what advice would you give them? Yes, please.
I would say, Daphne, definitely, and I mentioned that before, definitely be very passionate about what they're aiming to do. I think that from our perspective, and I know I'm speaking also for my co-founder, Hari Tsirba, when I'm saying that the challenges along the way are really hard to overcome if you're not doing something that you're really passionate about. I would say that, and many people are passionate about different things. It doesn't have to be, improving society or health or mental health or whatever. It could be other things. It could be a travel experience. It could be anything. However, I think that whatever you're working on, because it's probably going to take quite a longer time than you expect, definitely you have to enjoy it and be passionate about it. The second thing I would say is be patient, because it's going to take time. Those one-night successes do not really exist. Behind every one-night success, there are years and years of extremely hard work and a lot of disappointment. I have known many cases of founders that had a very successful outcome from their venture, that they were ready to quit just a few months before the successful outcome. So definitely it requires patience, and that's why it becomes even more important to do something that you're really passionate about, because at the end of the day, if you're doing something that you're passionate about, the outcome is always positive. The third thing that I would recommend is, especially to Greek founders that are starting from Greece, is to think big, to focus on the large issues, and to focus on to believe that they can create a big company, not something that will be limited to Greece or to the nearby countries, but something that could actually have global penetration and actually impact. So I think that as a country, we we maybe it is the it was caused to us because of the long debt crisis in Greece, but I think that we have the talent, uh, we have all we need in order to develop companies that can be global and start from Greece. That's something that the third thing that I would say.
So, do you think that this attitude of Greek of Greek, let's say, prospective founders towards risk, and have you seen this change in the past few years? Because it's really important to the way failure is perceived. If it's perceived as an opportunity to grow, an opportunity to learn, that would certainly facilitate thinking big and not hesitating to set the bar very high and the goal very high from the onset.
That is correct, and we see a lot of Greek startup companies or later stage companies like Workable or Softomotive or growing and achieving positive outcomes from a startup standpoint, and also most importantly reaching people globally and in a large scale. Absolutely, I think that we should follow those examples. I think that the whole Greek ecosystem now has started thinking towards that. But you know, many times, especially if we haven't had the opportunity to live abroad, to make it happen abroad, many times we have like this belief that it's going to be very hard. And I would say, and I'm sure that you have seen that in your experience in the Bay Area as well. Most of the founders are international. Many of the founders, if not most of them. Like you hear many different stories from many different people. So it's I would say where you're coming from shouldn't be an obstacle. I understand it is, especially these days, but we are not lacking anything. Someone that starts in Greece could develop a company, even if it takes more time, even if it takes more effort, could develop a company that could play in the global scene.
It's definitely the case that here in the Bay Area and Silicon Valley, startup founders come from all corners of the world, and indeed, I firmly believe that each and every Greek startup founder must find some way to come here to just for a visit, just to experience how it is and talk to other founders. Of course, at this point where travel has become so problematic and we never know, we still don't know what awaits us in the coming months. This is out of the question. But still, in a virtual way, Greek founders or prospective founders could reach out to people, and I believe many are open, since at least here in the Bay Area, it's as you can confirm, Yorgos, it's very much part of the mindset and of the culture, the giving back and the paying it forward attitude and mindset. So I would say, don't hesitate to reach out to people. They might have the time or decide to dedicate some time and energy to become mentors and advisors.
Absolutely, I agree 100%, Daphne. As Greeks, we should ask more. We don't ask enough, I think.
True. It is one of the character traits, I think, to be a bit more reserved, not to take the initiative. Not to seem too maybe pushy or.
Yeah. I think it's we're very proud as a nation. I think it's one of our character traits, as you said, and sometimes this become an obstacle. It's a really great characteristic, but sometimes it becomes an obstacle.
Just keeping in mind that being helped by someone um, should not seem like we're putting ourselves down, and it needs to you need to make yourself vulnerable when you go and ask for help, but keeping in mind that you will probably be in a position to give help to others later on when you succeed.
Correct.
Then that
Exactly.
might help, make that leap.
Change. That's a good point.
So, which brings me to my other questions that has to do with how your Greek heritage, how important it is to you, and how you see also your current professional activities developing in Greece.
Extremely important. I think that for who I am, I wouldn't change it for the world. And also I think it's reflected in our business very much. Both my co-founder and I are Greeks, born in Greece, grew up in Athens, and actually we both have origins from Naxos, so we might be a little bit biased against Naxos as well. And right now we have a team of almost 40 people in Athens. We have all our research and development, engineering, product operations in our Athens office, and we plan to continue growing that office as we grow as a company. In the US, we have our business development and sales teams primarily, and our clinical operations team, and also in Germany, a small presence. But the core of the company, although our headquarters are in San Francisco, the core of the company is Greek, and we intend this to remain that way. So extremely proud of the talent that we have as a country, and the things that we can achieve as long as we have the right resources, the right leadership, and we're going towards the right way.
We hope to see more companies follow this model. And so we want to see them here in Silicon Valley. That doesn't mean we want them to leave Greece. Here is the portal to the global market. They should come here, but following this model that you have, followed for your company, this brings tremendous value to the Greek ecosystem.
Absolutely, and we were lucky enough because we happened to be in the US when we started the company, so it was easier for us to make this transition. It was not really a transition. From day one, we had a team in Greece, a small team in Greece with a couple of interns, and my co-founder and I, and our head of R&D, who were in the US, trying to develop our first prototypes. So I think that the model definitely works. It has its own challenges. Don't get me wrong. Like the time difference itself, it is challenging, but it brings a lot of value to the Greek economy. Absolutely, as well as the companies, right? Having access to the level of talent that we have in Greece, as well as in a way that is less competitive than in San Francisco and Silicon Valley, it becomes a big advantage.
It's a big advantage indeed. Well, Yorgo, thank you very much for participating and learn from the Greeks. Let me show our audience again our logo. Take care, stay safe, and I hope to see you soon in the Bay Area again. So to our audience, Thank you so much for watching, and stay tuned for the next video of Learn from the Greeks.
Thank you very much, Daphne. Thank you very much, everyone.